Chronic back pain that doesn't stop even after multiple treatments. Does that sound familiar? Hello, this is Dr. Siddharth Amber, physician at Chicago Arthritis and Regenerative Medicine, expert in regenerative medicine and rheumatology. I had a patient recently ask me a tough but important question. Can you actually treat my chronic back pain? This individual had already gone through multiple surgeries and treatments, but the pain was constant. With a history of compression fractures, degenerative disc disease, and multiple kyphoplasties, they were understandably skeptical. I imagine this sounds familiar to a lot of you as well. Today, I want to answer that question. Can we treat this type of chronic back pain? In short, while we can't reverse the damage that's already been done, we can absolutely help by focusing on reducing inflammation and improving stability, resulting in less pain, better function, and improved quality of life. So let's dive in to what you can do and how we can help. To start, let's understand what's contributing to this type of chronic back pain that I'm talking about. Chronic injuries and degenerative disc disease each play a unique role in causing pain and stiffness. A strain or sprain of the back means that the ligaments that support the bones of the spine have been overstretched. As the ligaments get weakened over time, normal range of motion of the spine results in more stress on the facet joints, the discs, and the nerves, resulting in more pain. Degenerative disc disease, in essence, is essentially the wear and tear of the cushioning discs between your vertebrae. When these discs start to break down, the spine loses its flexibility and shock absorption. So now, basic movements can become painful and difficult, and this further increases instability in your spine. With these two issues combined, your spine is less stable, less flexible, and more prone to pain. Often the main sources of pain here are instability and chronic inflammation around the affected joints and nerves. So instead of focusing on fixing what's already damaged, we aim to strengthen the support around it and reduce inflammation. Now you might be wondering, why can't we just repair the damage? Unfortunately, the answer is that once you've had multiple injuries over years and degenerative changes develop in the spine, the structural damage is done. Think of it like wear and tear on a car that's seen some rough years. You can't erase that history, but you can make improvements to keep it running very well. That's where regenerative treatments come in. Instead of focusing on reversing the damage, we focus on providing stability, reducing pain, and improving function. This means strengthening the structures around your spine that can give it better support and addressing areas of inflammation that are causing pain. By taking this approach, we can help to reduce pain and increase your ability to move with less discomfort. One of the most effective tools we have for managing this type of chronic pain is regenerative medicine, specifically platelet-rich plasma and platelet lysate. Let me explain each one. First, platelet-rich plasma, or PRP, involves using a sample of your own blood to help to stabilize and strengthen the tissues around your spine. We draw a sample of blood from you, process it to separate out the platelets, and inject a concentrated PRP solution into the areas that need it most, specifically treating the nerves, the facet joints, the ligaments, and muscles. PRP helps by releasing growth factors that can strengthen your ligaments and soft tissues, which gives your spine more stability. And that increased stability helps to reduce pain. Then we have platelet lysate. This is a specialized form of PRP that's even more targeted for inflammation. With platelet lysate, we process the platelets in a way that releases the growth factors directly. This makes it a powerful option for reducing inflammation, particularly around nerves that are often inflamed in cases of chronic back pain. Both PRP and platelet lysate give us options to reduce pain without damaging tissues, which can happen with traditional steroid injections and nerve block procedures. By reducing inflammation and stabilizing the spine, we can make a meaningful improvement in pain and function for many patients. So why use regenerative treatments like PRP and platelet lysate instead of traditional options? One major reason is that they're much safer and friendlier to your tissue. For example, steroid injections, while effective in the short term, can actually weaken tissue over time, which can make things worse in the long run. With PRP and platelet lysate, we're working with your body's natural healing processes instead of introducing a substance that might cause harm. Patients often report significant reductions in pain, improved mobility, and the ability to return to activities they love, all with fewer risks compared to steroids or surgeries. By treating the pain with your own cells, we're able to provide a more sustainable way to manage chronic pain and improve your quality of life over the long term. In terms of long-term care, steroids work very short-term and then bring you back down to your baseline pain level. Platelet-rich plasma, on the other hand, slowly ramps up over time and keeps you at a higher level of improvement for longer term. Now, along with regenerative treatments, physical therapy is a powerful tool for stabilizing and supporting your spine as well. Exercises that target core muscles and improve hip stability can help give your spine the additional support it needs to stay stable. Working with a physical therapist who understands your condition can give you specific exercises that will make a real difference in managing your pain. Many patients find that strengthening these areas, improving flexibility, and learning better posture can reduce the daily strain on the spine, which leads to less pain and better functionality overall. Another essential piece of the puzzle is managing inflammation through lifestyle choices. I often recommend an anti-inflammatory diet to support overall back health. This includes foods that are rich in omega-3 fatty acids like fish, leafy greens, and spices like turmeric, which can help reduce inflammation in your body. In addition, staying active with low-impact exercises like walking or swimming, as well as getting adequate sleep, can go a long way towards supporting a healthy, stable spine. And of course, striving for your optimal weight level is important as well. If needed, losing weight can reduce stress on your lower back, which will help to reduce pain. So in my patient's example, who asked me that question about whether we could help with her chronic pain, multiple prior injuries and now chronic degenerative disc disease were driving her pain. We opted for treatment with PRP and platelet lysate, treated her affected nerves, facet joints, and unstable ligaments. She now has less pain, has been able to increase her exercise, walk more, and play with her grandkids more comfortably, and overall live a better and more enjoyable life. That is a good outcome for her. To wrap up, I want to leave you with this message. While we can't turn back time or undo the structural damage from chronic injuries and degeneration, there are treatments like PRP and platelet lysate that can make a big difference. By focusing on stability, reducing inflammation, and supporting your body's natural healing processes, we can help manage your pain and improve your quality of life. If you're feeling discouraged by chronic pain and looking for non-surgical options at work, know that there is hope. Thank you for watching. If you found this content helpful, please give us a like and subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.